everyone. Welcome to Conversations with Sekani, a podcast for people in their 20s who are trying to figure out life and not get lost along the way. Today's guest is Dr. Todd Joye, a physician with over 25 years of experience and the founder of InterveneMD. Dr. Joye works at the intersection of regenerative orthopedic and spine medicine, functional medicine, and longevity-focused care. But what really sets him apart is how he sees the body, not as separate parts to fix, but as one deeply connected system. He believes you can't truly fix a spine, joint, or even optimize surgery outcomes if you treat those areas in isolation. Immune health, inflammation, brain function, metabolism, gut health, and even cellular signaling all works together. A real healing happens when those systems are supported as one. Instead of teaching people how to live longer with disease, Dr. Joye challenges the idea that decline is inevitable. His mission is to address the root problem behind pain, brain fog, fatigue, and aging, and to remind us that the human body is far more intelligent and capable of healing than we've been led to believe. Today, we are exploring what traditional medicine often get wrong and what a smarter system-based approach to health really looks like. So, Dr. Joye, welcome to Conversations with Sekani. It's a pleasure to have you here.
Right. Thanks so much for having me. I'm looking forward to the discussion.
Right. So, yeah, I want us to start from the beginning, which is understanding your body early. You know, a lot of young people, they ignore health until something breaks. So what are we getting wrong about how the body actually works?
Well, for me, it's been a journey over the past 25 years in trying to understand how the body works and what we can do to fix it. But I think more importantly, the tools the body has on its own to fix itself. And particularly young folks, young adults, are critical in this because you can make a lot of choices early in life that will pay huge dividends for you as you get older. My background is in spine and orthopedics with pain management and treating joint pain and back pain and sciatica type pain. And I started realizing about 10 years ago that even though I was doing typical procedures and steroid injections and things like that, that they weren't helping as much as they used to. And I really started looking at how the body can heal itself. And, there's still a lot of things that I can reverse at my age, but really, it's really important for young adults to start realizing this and to be curious about the body and what it can do to heal itself. And there's a lot of discussions going around. There's a lot of social media. There's a lot of interest by young adults in the immune system, in brain fog, in the metabolic system, in peptides, for example. And it's fascinating to have people come to my office at a young age wanting to know what to do to help their bodies now, but also protect them later in life. It's a great privilege and thrill to hear patients coming in wanting to know more about their bodies at a young age.
Okay. Yeah, so we're actually here to also learn more too as young adults, actually, I personally. So yeah, why is treating symptoms alone a short-term fix? What do you think that is?
How's what?
Why do you think treating symptoms is a short-term fix, actually?
So our traditional medical system has really focused on symptoms for a long time. And symptoms are just really an indicator that something has gone wrong or there's a system that's misfiring in the body. And too often, traditional medicine tries to do things to cover those symptoms up. And if you do that, it's just going to pop up somewhere else, worse. It'll be potentially a bit like that game Whack-A-Mole, where you get a symptom and you push that down, another one just pops up worse down the road, unless you can look at it and try to figure, okay, what's going on with what do these symptoms mean? They're clues. And rather than trying to just give someone medication to cover that symptom up, we have to start digging deeper and being investigators to see what those symptoms are indicating deeper down the body. And oftentimes, after you get to be an adult, inevitably those symptoms tend to indicate a problem with the immune system or mitochondria, other things as well. But the symptoms are just a clue. Well, they're a clue, but also the symptoms are really what drives someone to go see the doctor in the first place. And that's good that it triggers that response for them to think, okay, I got something going on. I got something potentially that I need to look at. And then we can dive down into that to see what's going on really deep down. The root cause is what commonly is talked about with these things is let's take a symptom, let's identify what the root cause of that is.
So basically, it's very important that you know the root cause of some particular things, because sometimes symptoms are often, short term, and they could come back again if the root cause is not tackled, basically. Okay. So,
right. Yeah, and it's we have to get away from to kind of summarize that, we have to get away from the idea that the symptoms are the enemy. The symptoms are not the enemy. Symptoms are actually the body trying to send a message that the body's trying to heal. And so these symptoms are kind of signals. They're not failures. Just because you have a symptom doesn't mean anything failing. It's just a signal for us then to go in. And I think that doctors and patients themselves, regardless of the age of the patient, need to be curious about that and take that symptom and then do some deeper work on it with themselves. A lot of literature out there, a lot of resources on the internet, for example, for people to look up, but also to partner themselves with providers, medical providers that are interested in trying to do that deep dive with them.
Okay, yeah. Thank you so much for that, actually. And yeah, talking about systems thinking and the body, you say the body doesn't fail in isolation. So can you break that down in like simple terms for us?
Sure. In terms of what I've done over the past 25 years, I've been focused on trying to fix a spine or fix a joint or fix sciatica. And for us to believe as medical providers that we can identify one problem, if someone is having pain from a certain area of the body, that we can say your trouble is coming from this one joint, maybe it's just the shoulder joint or wherever it is, that we can pinpoint that. It's hard to do when we're older in life. If you're young and you have a problem, we can with more certainty say, oh, your problem's from this area, your problem's from your shoulder or your hand or your elbow or your back or your L4 disc in your lower back. But when you get older, the body starts aging in multiple places. And so we have to be able to separate that out in order to provide the best benefit for patients in trying to address these things. And so I can't truly fix someone's knee joint. I can't truly fix someone's back unless I also consider other parts of the body. So patients that come see me, for example, if they're coming in for sciatica or joint pain, I will often ask them, how's your sleep? How's your energy? How's your brain fog? How are your hormones? How's your gut? Because all those things factor into this. I may ask them how their immune system is, how their energy is, how their sleep is, all those things to get a better understanding. Because if I can incorporate all those areas into my treatment, then that's going to be a net benefit to the patient in the long run. And in a lot of cases, if I consider that, then I'll get a better outcome for the knee and the spine. Or if I'm treating the knee and the spine and I'm doing things in addition to, say, injections or prolotherapy or PRP or peptides or ozone or IVs or hormone therapies, I'm going to help their back and the knee. But guess what? I'm also going to do? I'm also going to fix their brain fog. We're going to fix their hormones. We're going to fix their energy. They're going to be sleeping better, and they're going to have less chance of dementia and cancer even. And so we have to start thinking of the body as a whole. Medicines has become too isolated, where doctors can go to medical school and residency and get trained in very minute areas of the body. There are surgeons that can specialize in an area of the body the size of a postage stamp, and that's all they do is just work on this one little area. It might be the eardrum, for example, and that's all they do. Or it may be a certain area of the body. It might just be one joint of the body. And I think that does patients a disservice because when you get so specialized in looking at things and you don't consider what's going on around you, it's tough. It's like driving a car. If you're driving a car and you've got blinders on, like you see the horses having on them sometimes, and all you can see is what's in front of you, and you can't see what's beside you, and cars coming in around you, then you're going to be pretty nervous driving a car like this, not being able to see what's around you. You take your hands away from your eyes, and all of a sudden you've got a more awareness of what's going on around you. And the same thing with medicine. We have to consider these things to get people the best outcomes.
All right. So basically, I can say that, brain fog, fatigue, and like chronic pain, they're connected in a way, right?
It is, yes. They're all connected because with those things in particular, most of the issues we have as adults, I said are energy related, mitochondria related, but immune system. The immune system drives everything in our body, and when your immune system is not working correctly, it will cause inflammation. And the downstream effects of inflammation, one of the biggest ones is arthritis. And people say, "Oh, well, I've got arthritis, and I've got my knee joint is bone on bone, and I have to get a knee replacement." Well, you can survive with bone on your knee joint and not have to get a knee replacement. Now, some people do, but you can get by without a knee replacement. And the arthritis is not being caused by the bone on bone. The arthritis is being caused by inflammation, and that's being caused by the immune system. And what's the problem with brain fog and Alzheimer's? That's inflammation. And it's your brain not able to use glucose correctly. But what's cancer? Cancer is inflammation. What's degenerative disc disease? That's inflammation. Arthritis, inflammation. All of these things are, heart disease. That's inflammation. So if you can address that, whether it's in the whatever part of the body it is, you're going to end up improving the brain, improving the heart, improving your risk for cancer and arthritis.
Okay. Yeah, I think I understand that one perfectly. But I want us to, talk about the modern medicine gaps, right? So what does like traditional healthcare do well, and where does it miss the bigger picture?
Mm-hmm. That's a great question. I think that we've normalized decline. We've accepted decline as just you're just getting old, and I think that's a problem. It's like telling someone that they look good for their age. We should be telling people they look good, period. It shouldn't be a factor relating to your age. That we tell people that the pain they're having, or the fatigue, or the brain fog, or the weight gain, or memory loss are just part of getting old. And these are oftentimes just signals that the body is starting to fail. The core systems, like we talked about before, the immune system, the metabolism, hormone, the repair of the body, that these systems are under stress or under attack even. And so, are we going to live to be 200 years old? No. Aging is normal. It's real, but accelerated aging driven by inflammation or lifestyle or the environment, those are things that are very different. And those are things where we can control. And that's unfortunately things where modern medicine kind of get in the way and don't recognize that. And we're too short to dismiss patients and tell them, this is just aging, you're fine. Or for that matter, getting labs on patients and telling a patient, nothing to worry here, your labs are normal, when we're trying to teach patients not to accept it when your doctor says your lab is normal, but not accept it when they say your vitamin D level is normal, or not accept it when they say your hormone levels are normal. That's, I don't think anybody wants to have normal labs. We'd like to have optimal labs. And so I think we should come back to medical providers and doctors and PAs and the people directing our healthcare and say, I understand my lab value is normal, but what's optimal for my age? Mm-hmm. So it's a change in mindset. And I think that's the discouraging thing about the current healthcare system, is that we're in this pattern of just normalizing decline, where we just say, don't worry about it, it's normal, you're getting old, and that's the way it's going to be.
Yeah. When you were saying we should not normalize accepting healthcare professionals telling us your tests are normal, your vitals are normal, I was like, is it not supposed to be normal, right? But making us understand now that it's supposed to be optimal and not normal, I think that is actually understandable, by the way.
Right.
So,
yeah, it's critical. And people, we tell people that, and they kind of start shaking their head like you did, that makes sense to me. And also that the way that the lab companies have changed things over the years is, they take these lab values that are normal. I'm going to age myself a little bit here, because there used to be a game on The Price is Right TV show where the price of an item is called the range game. And they had the item price, and once the range got within that price, you stop the machine, and that's the range where the price of the car is, or wherever. Well, same thing with lab values, is they've got these ranges where it's low and high. And what's happened over the past decade or so is that these lab companies have taken the normal range of lab values and brought them down to fit more people. So rather than leaving a lab normal range high and saying we've got populations that's below, we got to figure out how to address that. What are we doing wrong? We've just kind of lowered the bar to let more people in there so that we can tell more people they're normal. So, vitamin D is a good example of that, where the normal lab value range for vitamin D, if it's over about 35, most people are going to be told their vitamin D level is normal, but most people need a vitamin D level over 60. And if you had a vitamin D level over 60, you had a much lower risk of getting COVID than you did if your vitamin D level was less than that. But yet, if it's 40, you're going to be told it's a normal value. Hormones are kind of the same way, that we have normalized hormone levels, and that's doing people a disservice. Particularly in their 20s, we're seeing a lot of people in their 20s who have low hormones, and people aren't getting hormones checked until their 40s or 50s. But we try to encourage people now to get hormones checked in their 20s, so we can see what their levels are, so we'll know when they get older where we have to, target to get them replaced to.
Mm-hmm. All right, so yeah, I feel like I've learned so much already. I've learned so much, and I still have a whole lot of questions, but I'm trying to look at the time. But I want us to talk about, longevity and prevention, especially for the fact that my podcast is for young adults. So from a doctor to the the young ones. So for people in their 20s, what habits today do you think protects their future health?
So I think there are a lot of 20-year-olds out there who I see more and more of here who are very interested in health, and they challenge me and they come in asking about things. And that's very encouraging. There are also people on the other end of that spectrum who are coming in who have no idea. And so it's a challenge with this group of young adults. Um, one of the best um, one of the best longevity things that someone can do happens to be very inexpensive, and it's weight training. Um, Younger 20-year-olds have to get in the gym. You have to lift weights. You can't just go for a walk and or do yoga, which is great. You should go for walks after each meal because that helps pull the glucose from your meal into your muscle. But there's no way to get around the fact that you have to lift weights. And that's very inexpensive. You get a lot of young people out there now who, even if you're not working or you're working your way up the ladder in a company and your salary's not great, lifting weights is very inexpensive. And you can do that even at home using your body weight. It's critical because that increases muscle mass, it increases mitochondria, it gives you more energy, it prevents diabetes, it is great for your brain fog to lift weights and resistance train. The other thing that's growing right now is the use of these weight loss medications, the GLP-1 medications like semaglutide and Ozempic, and those are turning out to be the best longevity drugs out there that help and extend life. These drugs are phenomenal. They get a bad reputation in the media right now because people are taking them without medical supervision, or they're getting bad medical advice because those drugs can cause you to lose muscle if they're not monitored correctly. We have a lot of people in these medicines here. We monitor them very closely. We have a very high success rate. But those medications, in addition to losing weight, they prevent Alzheimer's, they reverse heart disease, they're anti-cancer. They're one of the best longevity drugs out there. Now it's going to be a cost to do those medications. So the resistance training is really good. And it's very hard for someone after the age of 70 to gain muscle. And so you want to do whatever you can until age 70 to gain muscle, because one of the main things that puts adults into a nursing home is when they can't get out of a chair unassisted, or you can't get off of a toilet unassisted. You've got no armrest to push on. You got to use your legs to stand up. And when you can't do that, then that's a sign that you got to go into a nursing home. So having strong muscles and even taking creatine, that's critically important as well, to take creatine. And that's very cheap. And so if you can do one thing, I would say lift weights and try to take creatine.
Wow. All right. So, you know, it's quite surprising. You spoke about Ozempic and all. I mean, it's in the media right now, especially Ozempic, and some people are saying there's like side effects to it. But coming from a medical professional, it's important to know that okay, it's not like they have a bad side effect. It needs to be prescribed by a medical professional, right? So that means it's
Yeah,
actually good to take Ozempic. Okay.
very good.
Oh,
Too many people taking these medications online. They're getting shipped to their house. They're dosing themselves. The problem when you take these medications or any diet, is your metabolism is going to slow down. And then you're going to lose weight and you're going to lose muscle. You're going to lose fat. And then your metabolism slows down. And then when you stop the medication, you start eating again. And so you start gaining weight back, and your metabolism is still slow. And so you gain more weight back. And now you're gaining more weight that's fat versus muscle. And now you're worse off. And so it needs to be monitored. And unfortunately, even people who are taking the drugs, one of the manufacturers or both of them provide these medications cheaply for patients, and they ship to their house, the pharmaceutical company, but they're not monitoring you for the muscle mass either. And so just because you're getting the name brand medication, that's a problem too, because you have to get monitored. You have to be coached on how much protein to eat, the creatine, the weightlifting. If you do it the right way, these are phenomenal medications. And don't be scared of them, but get monitored correctly.
Right. Okay, noted. And yes, this has been really, really educative. I've learned a whole lot from our conversation. And yeah, finally, I'd like to, talk about empowered health, right? So what questions should young adults always ask their doctors, basically?
Mm-hmm. I think the main thing is for young folks to, as I said before, to stay curious, to understand that there are a ton of options out there. Even people with chronic disease, is don't get discouraged. There are a lot of options out there. Stay curious, challenge your providers. This is we're in an age now where information's everywhere, and people are doing their homework. And I would encourage patients to take ownership. When I was growing up, if you went in the hospital for something or had surgery, you were in the hospital for a week. And nowadays you get surgery, you're out the door the next day, and you get home, and then you start thinking about, well, all these questions I have, they didn't answer these questions, and I was in and out of the hospital, and now I'm home and I don't know what to do. You have to take ownership of this. You have to talk about this with your family. You have to do research on it, be curious, and then come in with your medical providers and challenge them, and don't just fall into the routine of what pill do you have that will fix this, but get into a routine of saying, okay, what if I don't want that pill? What's really going on? And if you can't find someone that will do that for you, then it may be a good time to find someone else to take care of you.
Okay. So yeah, thank you so much for that. And this brings us to our final segment. It's called the rapid fire segment, actually.
Oh, good. Let's go.
All right. So health is.
What is it?
Health. I just needed to fill in the gap. Health is.
Help ease.
Health. I could say health is wealth. That's what I
Health
think.
is.
What do you think is?
Health is life.
Hmm.
Health is life.
All right. So what's the most misunderstood symptom?
From what I see, there are a lot of them, but I see a lot of misunderstood brain fog.
Okay. All right. Okay. Brain fog. Yeah. So energy killer people ignore.
What people ignore?
Energy killers people ignore.
I guess they ignore their body, and they don't get the answers that they need for that, for whatever's going on. Don't ignore your body.
Okay. All right. So prevention or cure.
I think we'd always prefer to have prevention, particularly in your audience that's in their 20s. I think that's a terrific spot to get into a prevention mode. I think modern medicine, traditional medicine, is very good at treating emergencies and treating acute problems. For chronic issues, we're not so good at treating that. So prevention.
Okay. And yeah, finally, if the body could talk, it would say,
Help.
ah, okay. It would say help. All right. Okay. So yeah, this has been amazing. It has been fun. And where can listeners get to know more about you and what you do?
Sure. I do a lot of education. My practice is called InterveneMD, and we're in South Carolina, and there's educational stuff on my website to get more information. But there's providers like me all around the country and the world. But feel free to review my website, get information out of it to educate yourself, to take you the next step of wherever that has to be to see someone to help you improve your life and your function.
So yeah, thank you so much. This has been inspiring. And to my audience, thanks for tuning in to Conversations with Sekani. If this episode sparked something in you, make sure to share to someone who you think might need this, and also subscribe so you don't miss out on new episode. Thank you, Todd, and do have a wonderful day.
Thank you very much. Enjoyed it.
All right. Bye.